Are sesame seeds good for fatty liver disease? It's a question we're hearing more and more, so let's look at what the evidence actually says. Fatty liver disease is far more common than most people realise. Around 1 in 3 adults in the UK are affected, and it's closely linked to obesity, type 2 diabetes, and metabolic syndrome. So understanding what diet can and can't do here really matters. Sesame seeds are genuinely nutrient dense. They contain healthy fats, protein, fibre, and important minerals. But what makes them particularly interesting from a liver health perspective are compounds called lignans, specifically sesamin and sesamolin. These have antioxidant properties, and some small studies suggest they may influence how the liver processes fat and help reduce inflammation. That said, it's important to be honest about the limits of that evidence. These studies are small and the findings are not yet conclusive. There is currently no official UK clinical guidance, including from NICE, recommending sesame seeds as a treatment for fatty liver disease. So while they may be a helpful addition to your diet, they are not a cure, and they shouldn't replace the interventions we know work. So what does work? According to NICE guidance, specifically NG49, the cornerstone of managing fatty liver disease is lifestyle modification. Gradual weight loss, reducing refined carbohydrates, increasing fibre intake, and regular physical activity are the evidence-based approaches. No specific medications are currently licensed in the UK for fatty liver disease, which makes dietary quality genuinely important. A Mediterranean-style diet is often discussed in this context, one that's rich in vegetables, whole grains, legumes, and healthy fats. Sesame seeds can fit into that pattern. A small portion, around 1 to 2 teaspoons, sprinkled onto salads, stirred into yogurt, or used in cooking is a reasonable way to include them. And it's worth keeping portions small, not just because of balance, but because sesame seeds are calorie dense, and managing overall calorie intake is an important part of fatty liver management. Before making significant changes to your diet, it's always worth speaking to your GP or a registered dietitian. They can help you understand how sesame fits within your overall plan, particularly if you have other conditions like type 2 diabetes or metabolic syndrome alongside fatty liver disease. On safety, sesame is classified as a major allergen in the UK. If you haven't eaten it before, introduce it gradually and watch for any reaction. If you experience symptoms like itching, swelling, or difficulty breathing, stop immediately and seek medical attention. If you've been diagnosed with fatty liver disease and have any concerns about how it's progressing, please do speak to your doctor. Your GP can use tools like the FIB4 score or an ELF blood test to assess your liver health and refer you to a specialist if needed. To recap, sesame seeds contain nutrients and antioxidant compounds that may support liver health, but the evidence is still limited and they are not a recommended treatment on their own. Lifestyle changes, particularly gradual weight loss, a better quality diet and regular movement, remain the most important steps as set out in NICE NG49. And always speak to a healthcare professional before making significant dietary changes, especially if you have an existing medical condition. Have you tried including sesame seeds in your diet? Let us know in the comments below. If you found this video helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.